specimen is a uterus from a 45-year-old, measuring only 4 by 3 by 2.5 centimeters. Presented with excessive bleeding and lower abdominal pain. She has 5 children and the last delivery was 12 years ago. Gross examination. This is a total abdominal hysterectomy specimen. We confirm orientation, record the measurements, and then open the uterine cavity. No obvious intramural mass is seen on cut section, but a polypoid lesion is clearly protruding from the cervix. Key gross points: a very small uterus, a cervical polyp, and no mass on cut section. Provisional impression: cervical polyp, but abnormal bleeding at 45 means the endometrium must be assessed on microscopy. On microscopy, we'll start with the cervix. This section shows a benign endocervical polyp. On low power, it has a polypoid architecture with benign endocervical type glands set in an edematous fibrovascular stroma, with associated inflammation. On higher power, the gland lining is bland and mucin secreting, without significant atypia, dysplasia, or any destructive invasion, supporting a benign endocervical polyp, which can easily explain abnormal bleeding due to its fragile inflamed surface. Next, we move to the endomyometrial region. At the endomyometrial junction, you can appreciate the transition from endometrium into the underlying smooth muscle of the myometrium. Importantly, away from the junction, we can identify endometrial glands with accompanying endometrial stroma embedded within the myometrium, surrounded by smooth muscle bundles. This gland stroma unit within myometrium is diagnostic of adenomyosis. The glands appear benign, with no cytologic atypia. Now, looking at the endometrium, the overall pattern is inactive or atrophic. It is relatively gland-poor, with small inactive appearing glands within a more fibrotic stroma. There is no gland crowding, no complex architecture, and no atypia, so there is no evidence of endometrial hyperplasia or malignancy in the examined sections. So, the final histologic impressions are benign endocervical polyp, adenomyosis, and inactive/atrophic endometrium. Findings that can correlate with the patient's bleeding and pelvic pain.